Good morning. This is Dr. McDaniel back at you on Thursday, May 9th, here on the GYN Corner page. Yesterday I spoke about Condylomata, which is the medical term for genital warts or venereal warts. And today I'm going to continue on that subject. So condylomata or genital warts are a sexual infection. They're caused by one or more of the low-risk strains of human papillomavirus or HPV, and it's caused by either skin-to-skin contact or contact of body fluids that have the virus active on someone's skin. In order to spread that virus, there has to be friction or an ability to what we call inoculate that area. So just dropping liquid on someone's skin or touching someone's skin is not going to be adequate. It has to be touching or liquid and then rubbed in. So with intercourse, with friction, that will cause an inoculation. It'll rub that virus into the tissues where the contact occurs, and that's how the virus gets embedded in that tissue area. If someone has infection from the HPV, it does not necessarily mean that they will have symptoms. And that's because the virus can have what we call asymptomatic shedding or symptomatic shedding. Asymptomatic shedding means that the virus is active, that person's contagious, but we don't see anything that looks like they have it, and they don't feel anything to confirm that they have an issue. Symptomatic shedding means that not only do they have the virus is active, but it's causing symptoms that we can see. And with condylomata or genital warts, that's going to be growths. As I mentioned yesterday, the growths can have a variety of presentations. They can be smooth and round, jagged, sharp, have finger-like projections, be rough. They can be flesh-colored, or they can have a pale ashen color. Predominantly, in my experience, if someone has a growth or a genital wart and it's darker than their usual skin color, so we call that hyperpigmented. So hyper means too much, and pigmented is discolored or flesh colored. So it's over coloration of their usual flesh color. That often is indicative of precancerous changes. So if someone has a really dark growth, regardless of whether you think it's a skin tag, a polyp, or a wart, it should be removed. If it's flesh-colored or lighter, and it was just noticed within a couple of weeks, then one can allow time for it to go away on its own. Now, that being said, most condylomata will not go away on their own unless you actively do something to try to suppress the viral activity, which is why the growths are there. HPV is what we call an opportunistic infection. So if someone has the virus, the only way that the virus is going to be active and shed, replicate, and potentially cause symptoms is if your immune system is compromised, because HPV takes advantage of a compromised or suppressed immune system. In order to suppress the virus and to potentially allow the condylomata to go away on their own, you have to increase the strength of your immune system. So you have to take supplements that will support the immune system. There are a lot of supplements that strengthen or support the immune system. The two, or really the one that works the best from what I've seen over the years, is L-lysine. It's an amino acid, and it comes in 500 milligrams and in 1,000 milligrams. And in my experience over almost 30 years, if someone takes 500 milligrams of the L-lysine once in the morning, once in the evening, so twice a day, every single day, like your life depends on it, without fail, that will strengthen the immune system and it will suppress the viral activity. Once the viral activity is suppressed, that will allow your body to exfoliate or to get rid of the growths that have appeared. What I always do when I see a patient with abnormal growths and they don't look really worrisome or concerning for precancerous changes, I recommend that they take the L-lysine twice a day every day for 4 to 6 weeks minimum, and then return in 4 to 6 weeks for a reevaluation of the status. Now, if that person's growth or increase in size, increase in number, or they just become bothersome, then I tell them to come in straight away. I'll remove the largest ones or the most worrisome ones by biopsies. I'll take a scalpel, I remove those, send them to the laboratory so they can be evaluated to get a diagnosis and to confirm viral activity. And what that also does is it decreases the viral activity present because, as I mentioned yesterday, the growths all actively shed the virus. So I do two things. I tell them to take the supplements for the immune system and to come back in 4 to 6 weeks if they feel that they have either done nothing, they're exactly the same, or they've decreased for a reevaluation, and then to come back as soon as possible if they're getting worse, larger, or they're just a problem. So the best treatment that I've seen is to take the supplements to strengthen the immune system, because it not only diminishes and decreases the viral activity and helps to shed or to relieve that person of the growths or the warts that we can see present at that point in time, but it also strengthens their immune system so that if they have the virus active in other areas where we don't see symptoms, so if they have asymptomatic shedding, it also helps to suppress the viral activity in those other areas. That's the best recommendation to naturally and to actively rid oneself of the symptoms of the virus, the genital warts or the growths. We also have treatments, and I'll go over the treatments tomorrow, Friday. This is Dr. McDaniel in GYN Corner. Today is Thursday, May 9th. I hope everyone has a great rest of the day, and see you tomorrow. Thank you for watching.